Hi, so I am talking a little bit about the benefits of breastfeeding while sick. Um, Breastfeeding is not contraindicated while being sick with like COVID-19, bronchitis, infections, things, simple things like that. It can be more difficult on the parent, but it's not a contraindication. In fact, any exposure that you are getting to an illness or virus, your body will create antibodies to pass through the breast milk to the baby to protect the baby from those illnesses and viruses. So it's actually detrimental to stop breastfeeding while you're sick. So it's actually more beneficial to continue breastfeeding. The World Health Organization says that even people who are positive with COVID-19, it's the benefits substantially outweigh the risk of breastfeeding while sick with COVID-19. There was a study done that shows that they tested the milk from 15 participants that had COVID-19, and 12 of their milk samples had antibody responses to COVID-19. So that just shows us that when a parent is sick with a cold or a virus or anything like that, that their body is constantly creating antibodies to help fight off these viruses for their newborn or their baby. And so it's actually detrimental to stop breastfeeding, and it's actually better to just continue breastfeeding if possible. I know that sometimes, illnesses, it's pretty self-limiting, so it can make you feel, like you might not want to be doing that. But some of the best things that you can do to cope, it would be to call in help. Like if you have the ability, call in help, and your main focus should be on resting, getting well, and feeding your baby. So stay hydrated, and that doesn't necessarily just mean water, electrolytes, bone broth, things like that, things that are going to heal from the inside out. Most over-the-counter medications are safe. Of course, ask if you're not sure, but Tylenol, ibuprofen, Mucinex, decongestants like Allegra, antihistamines such as like Claritin, and most antibiotics are safe during breastfeeding. The one medication that you might want to stay away from is Sudafed. That one can have like a drying out effect, so you definitely don't want to take that and risk milk supply, having a milk supply issue. But if you can, just be aware of washing hands, cleanliness like that. Skin to skin with your baby is going to help reduce stress, and that can help expedite healing. And also these viruses and illnesses such as like a common cold, flu, COVID-19, bronchitis, gastroenteritis, those types of things are not passed through milk. So we do know that COVID-19 and the flu and things like that are spread through droplets. So covering the sneezing, like in the crook of your arm, just trying to not expose the baby to those things, that is beneficial. But regardless, the milk supply that you have is going to change, and it's going to alter to help protect your baby and from these the illnesses and viruses. So I will link some of those articles and references below also. Thanks.